In Money Watch, half of the adults in the United States say that they are concerned that a major health event in their household could lead to bankruptcy. That's according to a recent Gallup and West Health study. So we asked Dr. Elisabeth Rosenthal to stop by and talk to us about dealing with unexpected medical bills. She is the editor-in-chief of Kaiser Health News and the author of An American Sickness: How Healthcare Became Big Business and How You Can Take It Back. Welcome, Doctor. Really appreciate you being here this morning. So
Thanks.
Let us start with, before you even get to the doctor, you're not feeling well, you're going to make a doctor's appointment. Is there anything that you can do before the doctor's appointment to reduce the risk of medical debt?
Sure. There's a lot of preparation you can do. And the thing is, I'm going to talk like this is preparing for a statistics final, but it's worth the trouble. The first thing is you have to make sure all the doctors who are going to be treating you are in your insurance network, that they have gotten pre-approval from your insurance network for the costs. And then I encourage everyone to try and get an estimate and get it in writing, because that way, when you want to argue, you say, look at this piece of paper. It says I owe $5,000, not $10,000. And then finally, try and get an understanding of what your insurance policy will expect you to pay. You know, if you have a $5,000 deductible, you are going to pay the first $5,000 no matter what. So make sure you have that kind of money in the bank, particularly with big elective procedures. This can be bank breaking. So go in armed, go in ready.
So go in ready. I love that. And that's just good for everything in life. But so you've been on CBS This Morning as part of your team's Bill of the Month investigation series. It's really fascinating when you see how, the same procedure in a different location can give you incredibly different bills. But, most of the time when people are ill, they're not in a state of mind to do some of the stuff that you suggested, though they should. And so they get these unexpected bills after the fact, after they've already seen, the medical professionals. Yeah. What options do patients have once they've received the bill?
Sure, there are options, and this is tragic. I know I'm giving people a lot of homework, but it's sad that you have to do this. The first thing I say is don't just write the check. You'll see these big numbers and, prompt pay, or we're going to send you to collections. Don't write the check. First thing is ask for an itemized bill. What am I paying for, like you would do at the supermarket or at a car repair shop? The second thing is, once you've seen the itemized bill, go through it. We know that 30 to 70% of hospital bills in particular contained errors. You can say, wait, I never had that test, or I never had that surgery, or that was a nurse walking me down the hall. That wasn't a physical therapy session. So you may get things taken off the bill successfully that way. The next thing is the next thing to know is that you can negotiate. People think a bill is a bill is a bill is in the rest of life. No, you can say, I'll give you $2,000 for this $3,000 bill, because that's what Medicare pays. There are helpful sites like Healthcare Blue Book, Fair Health, to show you what other hospitals or physicians and patients are paying in your region. So use those. Go in armed for your negotiation. Other little things, if it's something that doesn't need to be done in the ER, if they say, oh, we can get this scan now while you're in the ER, or you can get it as an outpatient, get it as an outpatient, because you'll have time to look around for better price deals. And also, everything done in the ER is going to be many times more expensive than it is as an outpatient. So be smart about how you do this, and fight back. I mean, your last resort is you can appeal to the hospital for some kind of financial aid. And you may be eligible even though you think you're not in the rest of your life, because hospital bills are so expensive.
So it is currently open enrollment season for health insurance companies. I don't know what it's like for a lot of you guys out there. I know, several months ago I got a letter from my insurance company essentially warning that a lot of things are going to change because of the COVID crisis, because insurance companies found themselves, taking on some pretty big bills that they had not expected. What can viewers keep in mind if they're thinking about signing up for new health insurance or changing their plan?
Yeah, there are things you should think about, and I want to speak for patients here because we got a bill to our bill of the month yesterday that was for $11,000 for a patient who went to an emergency room and didn't even get treated. She signed out because she'd been waiting for 5 hours. How familiar is that with nothing done? And she got billed
Wow.
for 11,000. So anyway, know what you're getting into. This is a fight, and when you're choosing an insurance plan, don't just look at the deductible. Look at the premium, look at the deductible, but also have a good look at co-insurance and yearly out-of-pocket maximums. Co-insurance, even after you paid through your deductible, means that you're going to pay maybe 20% of everything that happens in the hospital, and that could easily add up to tens of thousands of dollars. Look at your out-of-pocket maximum. Make sure you have that much in the bank or have a way to get that much, because if you get sick, you could well be expected to pay that in the next year. This is a big, big task. I'm sorry to have to ask American patients to do this. And I hope in the future we'll have a system that doesn't require this kind of incredible homework when you're sick. It's terrible.
No, doctor, the work that you're doing is really, really essential. You know, when it comes to billing and hospitals and medical care, rather, it's been very, very opaque. And I think people don't realize that they do have power, that they can be their own advocate. You sort of feel like you get stuffed into the system and then you're pushed out the other end, and whatever the bill is, you have to take it. That's not necessarily the case. So not only fight for the highest health care that you can get, but also fight for the best bill that you can get too. So we really appreciate it, Dr. Rosenthal. I hope we can have you on again.
I'd be happy to be here, and I tell people, fight for your hospital bill the same way you fight for your car repair bill. You can question this and you can negotiate.
Great advice. Thank you.
Thank you.